You've tried everything for your acne: creams, clinics, diets, maybe even oral medications. And yet, you're still experiencing recurring breakouts. If that's familiar, it's important to understand that persistent acne is often not due to doing something wrong, but because acne is a multifactorial condition. Many treatments target only one contributing factor rather than the full picture. I'm Dr. Chua, and I treat over 100 acne patients each month. And in my clinical practice, I see a consistent pattern among patients with recurrent acne. Today, I'll walk you through 3 reasons why, and what can be done more effectively. Reason number 1. Acne is a self-perpetuating cycle. Acne is not a single issue, but a sequence of interconnected processes. It begins with increased oil production and abnormal keratinization, which leads to clogged pores. Within these clogged pores, C. acnes bacteria multiply, triggering inflammation. These processes are closely interdependent. Importantly, that inflammation can impair the skin barrier, and a compromised skin barrier may be more reactive, more sensitive, and more prone to breakouts. This creates what we refer to as the acne cycle. It also explains why a single treatment alone is often insufficient to achieve lasting control. Even if one stage is addressed, other contributing factors may continue to drive the cycle. More effective management typically involves combination therapy that addresses multiple pathways simultaneously. Reason number 2. Your hormones are playing a bigger role than you think. Hormones play a significant role in acne, particularly in adults. If your breakouts tend to flare up around your menstrual cycle or during periods of high stress or poor sleep, hormonal influences are likely part of the picture. So what's happening is that hormonal fluctuations can increase your sebum production, the oil your skin produces, and that feeds directly into the acne cycle. Adult acne, especially in women in their 20s to 40s, often presents differently from teenage acne and may persist due to ongoing hormonal influences rather than transient pubertal changes. In appropriate cases, treatment plans may include options that address hormonal factors rather than just relying on topical treatments alone. Reason number 3. Your environment is working against you. If you're living in Singapore, your skin is exposed to environmental factors that can make acne more challenging to manage. The heat and humidity year-round can increase sebum production and sweating. On top of that, frequent transitions between outdoor heat and air-conditioned indoor environments may contribute to skin barrier stress. Another factor that's often overlooked is diet. Diets high in refined carbohydrates and certain dairy products may contribute to acne in some individuals, although responses can vary. These dietary patterns can also influence your gut environment, and there's a growing body of research exploring the link between your gut health and skin health, often referred to as the gut-skin axis. When your gut bacteria is imbalanced, it may promote inflammation throughout your body, which can in turn affect the skin. So when you combine environmental conditions, dietary habits, and the stress of a fast-paced environment in Singapore, your skin is fighting on multiple fronts. So what can you actually do about it? Here are 3 things to keep in mind. Number 1, cleanse properly but don't overdo it. Many patients tell me that they use strong cleansers because their skin feels oily, but in reality, many of them have combination skin where the T-zone appears oily while the cheeks are actually dry. Cleansing to remove excess oils, sweat, and impurities is important for acne management. However, over-cleansing and using overly harsh products can disrupt the skin barrier, which may worsen irritation and potentially aggravate breakouts. The key is balance. Cleanse effectively but gently, and avoid overdoing it. Number 2, pay attention to what you eat. Rather than extreme restrictions, focus on sustainable dietary habits, such as reducing excessive, high glycemic, and highly processed foods if you notice that they trigger your breakouts. Number 3, consider a comprehensive treatment approach. If you've been trying one treatment at a time, switching from one cream to another and then maybe a supplement without lasting results, it may be because acne often requires a multimodal approach. Addressing different stages of the acne cycle simultaneously is typically more effective than treating them in isolation, and that's the approach we take in our clinic. I'll be sharing more on the gut-skin connection in a separate post, so follow us if that's of interest. If you find this helpful, do like and subscribe. It helps us reach more people dealing with similar concerns. And if you've been struggling with persistent acne and would like a clearer understanding of your skin, you're welcome to reach out via WhatsApp. Thank you for watching, and I'll see you in the next video.